I would wrap my mum's dupatta around as a sari. Just feeling like who I am is so fundamentally shameful that it's something to be laughed at by everybody.
Gender identity develops very early and it's an innate automatic process.
Dysphoria very typically means what? It means discomfort.
Fetus, that's female by sex, the body is female, but the brain is masculinized.
I had a girlfriend. She was German. I couldn't be the boyfriend that she wanted because I wasn't a boy to begin with.
Yeah. Children as young as 8-9 years of age, they have chosen their pronouns, they've chosen their names.
I was assigned male at birth and wasn't sure who I was attracted to. That's the journey I'm still figuring out to this day.
In no other species, young ones are raised differently by the parents based only on their sex. These are the clothes that they need to wear, these are their colors, these are their walk, look, talk, feel, behave. These are called as gender norms.
Why have we created these norms?
Propagate patriarchy.
That's usually an answer for many things.
Back in the 60s, 70s, 80s, it would entail behavioral therapy.
They would make you watch, probably, let's say, heterosexual porn for hours and days together so that your brain gets conditioned to like people of opposite sex.
I had several Justin Bieber posters in my room, but Dad would say, to pagal hai.
Typically, how much would it cost? And I'm thinking because everything is typically difficult when you're a woman.
Yes. Well, maintaining a woman's body is definitely more expensive.
There was sexual assault, making me depressed, harm myself, suicidal. I was in a really, really bad place.
What does it really mean to become who you are? Not the version of you that fits neatly into boxes, traditions, or expectations, but the version that feels true in your bones, in your breath, in your being. Gender identity remains one of the most misunderstood and taboo topics around us. And for someone navigating that journey, from confusion to clarity, from fear to freedom, it can be unbearably isolating. We're joined today by a dedicated doctor and an accomplished actor who has become a key voice in the transgender community. With her expertise in healthcare and her own personal journey, she offers a unique and compassionate perspective on gender transition. Her work as an advocate for inclusivity and healthcare access continues to inspire and inform both professionals and individuals navigating their own paths. We're excited to have Dr. Trinetra Haldar Gummaraju with us today.
Thank you so much for having me. It's wonderful to be here.
Thank you for being here. Our second guest today is a psychiatrist with years of experience in mental health, specializing in supporting transgender individuals through their transitions. With an approach rooted in empathy, understanding, and clinical expertise, he has helped countless individuals navigate the psychological aspects of their gender journey. His work goes beyond just therapy. It's about fostering self-acceptance. It's about resilience and empowering people to live their truth. We are so elated to have Dr. Armaan Pandey with us.
Thank you so much for inviting me here, sir.
Thank you, both of you. And I just want to say I'm really looking forward to having this conversation. And first off, Trinetra, I just wanted to ask you, do you enjoy having these conversations at all?
I really do. Okay. I mean, there are times where I'm just like, oh,
yeah, I'm sure.
No, but I think that when it comes from an education POV, you make peace with the fact that it's a never-ending process. And if you've chosen to put your journey out there in a very conscious way, you do have to make peace with talking about it over and over in a way that's obviously for education. So I'm okay with it.
Actually, if you'd said no, then I would have been like, where do we go from here? So if I can take you back, because really it comes from a place of wanting to know, wanting to build empathy. I haven't had many conversations like this in the past. So if I say something that is offensive in any way, or if I make mistakes, then please do stop me, please correct me, because that is not my intent at all. And in fact, I'm telling this to all of my guests because we're having all kinds of conversations and sometimes I want to ask personal questions, but if I overstep, then please stop me.
I think we're all very capable of offending each other regardless of gender.
Yeah, that's true. It's very true. But if I can take you back to your childhood, maybe some of your earliest memories, was there like a particular instant where you realized that there is this disconnect between who you are and the body that you're in, or how the world sees you? Or was it sort of a gradual realization over time?
I think as a child, you don't have two things, right? A, you don't have the language around gender, sexuality, the literacy around it at all. And two, you also don't have the conditioning of having to be a certain kind of way as a little boy. And that happens a little later. So I think when I was a child, I was far more free, far more uninhibited until I was like 4 or 5 years old. I would dress up and in a way that all kids do, like
Yes.
every parent, you know, puts their kids in drag for the fun photos and, you know, all of that. But for me, I think the fact that it wasn't a phase, the fact that it continued to happen for a while and not in a way that was play and fun, but in a way that felt very fundamental to who I was, my identity. And that was a gradual realization, but there were certain moments I remember with such clarity. Like there was this one time where I would wrap my mum's dupatta around as a skirt, but it would also become a sari. Like, you know.
And you were around how old at this point?
3, 4-ish. And I remember I draped it around myself as a sari. And my neighbor comes over and yells at me saying, what kind of boy does this? And, you know, it was a neighbor, it wasn't my parents. Because my parents were humoring me up until this point. But I think this was the first time that I felt like, oh, something's wrong. Like, this is not the way that I'm supposed to be. And that, of course, kept happening over time, again and again. And that's when you realize that, oh, okay, something is definitely happening that isn't what society considers normal. But this dupatta moment was quite, it stayed with me.
And then was it maybe like a couple of years later or later that you felt, like, did it reinforce that sense that something doesn't feel right to me?
Yeah, I feel like firstly, for every trans person, it's a very different journey. There's no, you know, two people with the same journey at all. But for me in particular, I think there was another instance in the 2nd grade, and this is funny in retrospect, but traumatizing when it happened.
Like a lot of things.
We used to stay in Hyderabad, and every Sunday we'd go to General Bazaar. And there was this hair clip shop, right, with lots of fancy hair clips and things like that. And my mum had short hair. So I had no way of cheating this and being like, this is for mom. So there was no excuse, I couldn't buy one. But in school, there was this girl who had the same exact thing, like same exact color, and she'd wear it and come.
And you wanted it.
And I wanted it. And the teacher was like, this is too colorful for school or whatever, so take it off. And I was like, can you give it to me? And she does give it to me, and I've kept it in my bag. And towards the end of the day, the teacher was like, you removed it already, where is it? And she obviously tells the teacher that she's given it to me. And I'm 7 years old, and the teacher is just like, why do you have it? Why do you want it? And I said, oh, it's for my mom, actually. I wanted to give it to her as a gift.
So you were aware at this point that you had to make up a lie to defend this?
Yeah, because I think kids realize very early on who they are to some extent, and also who they shouldn't be in order to gain the validation, acceptance of the people around them, their friends, family, and so on and so forth. And I was this straight A's, nerdy, like teacher's pet kid, so I had to be the good kid. That was very important. I think doctors relate.
I don't know. We'll ask you when we come to you.
And she took the clip and she pulled my hair and put the clip on my hair in front of the whole class, the teacher, for 2 whole periods to be like, you wanted it, now wear it in front of everybody.
Really?
The teacher did this?
Yeah. And I was happy to wear it, just not in front of the whole class.
Yeah, not in this kind of, like I'm happy, but it's sort of like shaming you.
Shaming you. And so, you know, and this was like a double period, so it was like an hour. And so I kind of just sat there with the entire class laughing at me the entire time, and I couldn't take it off. And I think that was such a formative memory for me in developing shame around my femininity or identity. And I think that takes a lifetime, right, to undo that kind of trauma and that kind of just feeling like who I am is so fundamentally shameful that it's something to be laughed at by everybody. So yeah, many memories like that I think over time accumulate, and then, you know, the bad stuff and the good stuff makes you realize that, okay, this is who I am. And unfortunately and fortunately, and I say fortunately because I was still very young when I had the opportunity to transition, but it was only in college that I knew for sure what the words were, what
Right.
the journey looks like, and what needs to be done.
And that is many, many, many years.
Many years later.
Right.
And lots of undoing the shame, undoing the, stigma that you internalize, because you don't want to be something that people laugh at. You don't want to be something that, especially as a doctor, especially as, someone that's in the STEM field, someone that's a good student. But I think the sciences and the studies, all of that is what kept me safe in a way. It was my street cred. It was me saying, you can say whatever you want, but this you cannot take away from me.
Yeah.
Right.
That, of course, happened in grade 2, and then there was college, and of course there was a lot that happened in the interim, and I will come back to you for that. But I wanted to ask you, Dr. Pandey, why you think that there is, like on a more personal level with the people that you encounter, a sense sometimes of this great disconnect between the sex that they're assigned and who they feel they intrinsically are. Like, why does that happen?
So actually, even before we try to understand why some people feel the disconnect, let's try to shed some light on how does gender identity develop in the first place. Like, what part of your brain tells you whether you're a woman or a man or a boy or a girl? As a mental health expert and someone who studied extensively about this topic, I can tell you we have no clue.
Oh,
We have no
I was
idea.
like, all right then.
Something else that we don't know.
We have very little knowledge about the human brain, especially the conscious part, the experiencing part. But what we do know for certain as far as gender identity is concerned, for anyone with the connect, disconnect, whatever it
Right.
is that it develops very early in our age, almost since birth. It's only a matter of time that children discover who they are. I mean, I have had kids in my own family, my nieces and nephews, who have at the age of 2 started imitating their parents. Like someone would try to put on makeup like their mother, or
Yes.
someone would try to shave their facial hair, which is non-existent, to the horror of their parents.
Right.
But at that age, gender is pretty irrelevant even to parents. No one is telling them that, hey, you have to behave like this to be a boy, to be a girl. But the kids are already showing that inclination
Right.
from whatever they're seeing around.
Right.
So gender identity develops very early, and it's an innate automatic process. It's not because someone is telling you that you have these parts, body parts, and therefore you're supposed to be like this. It's a very innate process. In most children, there is a sense of congruence about how they feel about themselves internally and what the world expects them to feel based on their sex, based on their physical attributes,
So you're
basically.
saying for most people that kind of marries?
Yes, this is called as congruence.
Right.
And for some people, there is an incongruence,
Right.
which can lead to gender dysphoria, that disconnect that you're talking about.
And that is called gender dysphoria.
Yes, it can lead to gender dysphoria, but gender incongruence is a broader term that we can use. I think we'll clarify what the difference is as we go further. But what happens is that, some research points towards hormonal factors or genetic factors. For example, there could be a fetus that's female by sex. And while this fetus is in the mother's womb, perhaps there has been a surge of androgens,
Right.
basically male hormones, in the mother's blood, which might masculinize this fetus's brain. So when this child is born, the body is female, but the brain is masculinized.
I don't mean to interrupt you, but I remember when I was pregnant, there was some medication, and my doctor said if you take this medication, it could change the sex of your child.
It could, exactly. So during the developmental phase inside the womb, there are many such strategic, points in time.
Right.
When certain parts of your body or your brain are susceptible to permanent change.
Right.
All right. So this person is born as a female but has a male brain or masculine brain, and they might develop a male gender identity as they grow up. Similarly, we have seen in certain cases that, let's say that it's a male fetus and there is a surge of testosterone that normally does happen in utero, and it masculinizes the entire body, but the brain does not receive the information that testosterone is sending. Basically, the brain doesn't have those receptors,
Right.
which can interpret that, hey, you have to masculinize.
Right.
This could be sometimes genetic.
Right.
And then what happens that the brain remains feminine, and then this child is born with a male body, but the brain is feminine, and they might develop a female gender identity. Now, this is still at a very research level. Like I said, it's impossible to pinpoint what part of our brain determines our gender identity, but these are some things that we know do operate. It's biological. It's not something that we learn as we
Conditioning.
grow.
Or that somebody
Yes.
forces on you.
Absolutely. Environment can affect the gender norms that we have. It can affect the stereotypes that we develop. It can impact the level of incongruence that we might have, but it does not affect our gender identity. It just changes the options. But our identity is the one that chooses the options. And it's very unique for everyone, with or without the disconnect. I might also add that this is all a normal variation of human sexuality.
It's a spectrum.
It's a spectrum. None of this is pathological. All right? All of us are born with a unique sense of gender identity, and it may or may not be congruent to the norms that are there.
So I have a friend, Niranjana, and for every podcast we do, she asks what she thinks is a controversial question. It's actually an assumption. Her assumption is that children are too young to understand gender and they should be left free of its shackles, which I think means that they should not have to think about gender. They should be brought up in a way that is more neutral. And perhaps they should not be making these decisions before they reach a certain age.
I like the idea, but I don't think it's humanly possible to implement it. We human beings are unique in two aspects from most other animals. One is that we are probably the most self-aware species on this planet. And by that what I mean is that we can see ourselves. There's a picture of me in my head, which we can't confirm is there for other animals. We need a sound that's unique to us, that describes us. As a child is growing up, by 3-4 years of age, they become quite self-aware. They can see themselves. They have an image, a representation of themselves. They say that this is my name. And then they say, I'm a boy or a girl.
Yes.
And it doesn't matter whether you've taught them their anatomy, they've received their primary sex education or not. This happens because as they're growing up, they're looking at other people. They're looking at the world around. And they're liking and disliking things about the world.
Yeah.
And their brain is creating an image of themselves that, you know, this is who you are. And in that, there's a spectrum of gender identity. So as I'm growing up, I'm like, oh, I like to dress up like my dad. I like to, you know, go out of my house to work like him, but I also like cooking like my mom. I like to keep the house, make the house like my mom does. So my gender identity is developing somewhere on that spectrum, and that's automatic.
Right.
Definitely, I am also a proponent of not, imposing gender stereotypes too stringently. But again, we are people, we all have our personalities, we all have our value systems, our, desires, likes, dislikes, opinions. And I think it's totally fair that parents pass that on in a nice way to their kids.
Right.
Not in an imposing way, but they need to present what they believe in.
Yes.
That's how we guide our kids.
True. In fact, my mother, I remember we were talking the other day and she said it's so interesting because, you meet somebody and you may forget a lot of things about them, but you'll never forget whether they were a man or a woman.
Yes. It's a very core thing.
It's a very core part of your identity.
It's a very core part of our identity.
So Ninna's wrong. I really get the sense from doing all of these podcasts that the message is that every single person is unique. Like every individual is different.
You touched upon the congruence and the dysphoria. I want to come to that. Before that, I thought I would ask you, Trinetra, did you ever...
perhaps maybe at the later stages, did you ever reflect on the incongruence and the dysphoria for you, and which one did you feel?
I think with most kids, the incongruence sets in pretty early, like you were saying, even if... so dysphoria very typically means what? It means discomfort.
Right.
And gender dysphoria means discomfort associated with your gender being incongruent with your sex.
Right.
And that incongruence is nothing but the difference. So the levels of dysphoria vary from person to person. The levels of discomfort are different.
Right.
For me personally, I think from age 3-4 is when the incongruence was so obvious and so evident to everybody as far as social norms and things were concerned. But when I started to hit puberty for the first time, like 12, 13, my voice started to change, and everything that happens to a quote unquote male body. That's when it started dawning on me that I am becoming a man, so to speak, right? And on some level, there is this delusional, childlike part of you that watches an Aja Nachli at age 10 and just magically believes that I will grow up to be this beautiful woman. And when puberty starts happening, it's like your body telling you, no, that's not
it's going to be tough.
I'm not on board.
Not on board. And I think that's when the reality of your biology starts kicking in, and that intensified the distress, the discomfort, Significantly. So I think the gender dysphoria kicked in very hard
Yes,
in my teen years at the time, because I was also an effeminate boy, so to speak. So in class, I was the boy with a high-pitched voice that was a late bloomer. So hitting puberty in some ways was also, you know, socially acceptable and made me fit in with the boys a bit more. But at the same time, on a personal level, on an internal level, it was deeply sort of, I don't know, horrifying.
Taking you further away from...
Yeah. And the funny thing is, I thought that that disconnect was insecurity, perhaps, you know, because I was a bit of a chubby kid and I wasn't the most attractive looking boy either.
As it is at that time, there's so many things
happening,
that are happening.
And there's kids dating and, you know, all of this is happening. And so I was like, I will become the most attractive boy ever. And so I went to the gym, I started playing sport, I did this whole, I will be really mask, you know, I will try to fit in. And it worked. I had a girlfriend for a bit, and it worked socially, not internally. I feel like internally it just took me so much further away from who I was. And it made no sense at the time. I was like, I look good, I have validation, I'm a cute boy, I have a girlfriend.
My life could be very simple.
Yeah, exactly. And the thing is, she was German, so everyone was like, how did this queer, faggoty kid, you know, end up dating this person? But it slowly became evident to me that this is a gender thing, that this is not a, you know, it's not an insecurity thing or a body image thing, or even a sexual orientation thing for that matter. And we're still friends, actually, like even after all of this time. But who I was in my body, in myself at the moment, I couldn't be the boyfriend that she wanted, because I wasn't a boy to begin with.
Right.
That was really...
No, there's so much going on there in terms of, and I think people also get confused between what is sexual identity and what is gender, and I can ask you more about that, Dr. Pandey. But I wanted to ask you at this point, Trinetra, do you then feel like, is there some particular person that you turn to talk this through?
Nobody knew. At this point, it was nobody. My parents had no idea. I had no idea. My friends, I mean, I didn't have the language to say anything to anybody.
And of course, at this point, you're not even aware, like, that this is happening.
Yeah.
So you're really like in the...
Confused. And I thought, okay, if I am attracted to this person and she's female and I'm assigned male at birth, so I must be straight then, and I must be a boy, and what am I actually?
Yes.
Like, it was this weird, confused headspace of what does this mean? And that's the thing about gender norms, right? It lays everything out with such like clarity and precision that if you are a boy, you will be attracted to XYZ, you will behave a certain way, you will do this. So the second something doesn't fit that box, it's a mess, because you don't know where to put yourself, society doesn't know where to put you. But I think what people do need to understand is that gender identity, your biological sex, and your sexual orientation are three distinct, unique entities. Many a time there may be some overlap, and what is expected of each of those entities matches, right? Like one could be born biologically male, identify as male, and be attracted to women,
right.
Which is the case with a lot of men.
Right.
But for me, I was assigned male at birth, did not identify as male, and wasn't sure who I was attracted to.
Right.
And I think that's the journey I'm still figuring out to this day. You know,
Right.
I don't take my sexuality too seriously. I don't put a label on it.
Yeah.
But for the
people
most,
like to understand. Like, we need to understand.
Yeah, but for the most part, you know, my partners have been male, and to make it easier for people, I'll just be like, whatever, man. Like, this is my partner. Like, I don't have the patience to sit and like break this down for you.
I don't.
So Dr. Pandey, if I could just ask you, maybe for our viewers, could you explain the key differences between what we're talking about, between sex, gender, and sexuality?
I think Trinetra has pretty clearly talked about three different aspects of human sexuality. Sex is when a baby is born, we can look at their body, and most of the times we can say this is a male or a female. So this depends on their external genitalia, their internal genitalia, and their chromosomes.
Right.
Human males have XY sex chromosomes and females have XX chromosomes. This is called a sexual dimorphism, like two members of a species who are different in these aspects from each other. This is seen in human beings and most other animals and a lot of plants also. What is very, very unique to humans is the concept of gender.
Yes.
In no other species that we are aware of, children or young ones are raised differently by the parents based only on their sex. Everyone is raised the same way, has to do all the same things that every other member of the species does, except for maybe reproductive functions. But as soon as a child is born in the human society, based on their physical appearance, we have a set of rules that these are the clothes that they need to wear, these are their colors, these are their pronouns, their grammar, this is how they should walk, look, talk, feel, behave, work, everything. These are called as gender norms, and they change from time to time, society to society. But like, I was saying earlier, and Trinetra also spoke in the same timeline terms, by the age of 3 years, we also develop a lot of self-awareness. That's another unique thing about the human brain. We need to have a sound to our existence. That's our name.
Right.
No other animal cares about that. But we need to know how we are similar and different from other people.
Right.
That's the meaning of identity.
Right.
And gender norms play a huge role in helping me see myself.
Yeah.
Okay, am I similar to this person? Am I different from this person? In what aspects? And it gives me a clearer idea of who I am.
Right.
So by 3-4 years of age, like you were saying, you have a clearer sense of your gender identity. It is very unique in the sense that it's on a spectrum. If these are the norms for masculinity in my culture and these are the norms for femininity, I could be anywhere on this spectrum. Most people find themselves towards some or the other end of the spectrum. That's why we call it binary.
Right.
But people could be anywhere. Like, I love the way my dad used to dress, and I used to want to dress up like him. But I also like the way my mom used to keep the house.
Right.
So if that's considered feminine, then maybe, okay, fine, 8 out of 10 masculine norms, 2 out of 10 feminine norms.
Why have we created these norms? I mean, can you think of any reasons?
There are speculations by historians, but we don't know. Okay. Some say that it was to, propagate patriarchy.
Sure.
But we have
That's
no...
usually an answer for many
yes,
things.
I know. But nobody really knows. But to date, I don't think we are aware of a gender-free or gender-neutral society of human civilization. Gender has more or less has been, a norm in most recorded history of human civilization. So, so that's how this identity develops. Even though it's a man-made construct, but the human brain wants to understand who am I, and therefore that identity develops. That's your gender identity.
Right.
And sexual orientation is about the other person. Who am I attracted to?
Right.
Okay, same-sex person, opposite-sex person, people of all genders, nobody. So there are all these different sexual orientations. And again, to emphasize your point, Trinetra, these things are independent of each other.
Right.
Anything could be in any trajectory.
So I just wanted to understand, because, of course, Trinetra referred to the fact that maybe 20 years ago in Hyderabad, there was not much awareness. There was not much representation. Children didn't really understand or express that this was happening to them. Cut to now, we live and we stay in Mumbai, which is, typically we would think that some of the most progressive members of the population would be living here. Have things changed in terms of your interactions with students in schools? Is there more awareness? Is there more education?
Definitely, there's a lot more exposure these days, especially thanks to the internet and social media. I have seen children as young as 8-9 years of age expressing their incongruence, but not yet dysphoria maybe.
Right.
But they have expressed, and they have chosen their pronouns, they have chosen their names. And to, this is a really beautiful thing, that other people have helped them, supported them, their peers, their teachers, their parents. These are exceptions though. Most of the times, again, it's very important that we are not outcast. We want to blend in. We don't want to be outcast in a negative way especially. So children don't express. But yes, the awareness is on the rise, exposure is there. Not just in a metro city like Mumbai, but even in the interiors, I see people are much more aware of the options to transition, what this is called. So I'm seeing my clients' age is getting younger and younger. Earlier they used to approach me in their late 20s maybe, now it's between 18 to 22 years of age that they start looking for transition.
And in terms of stigma, because I feel like even though we resist labels and we resist labeling, I feel like when you call a spade, then with that you get education and you get assistance and regulation and all those things come with it. So where are we in terms of stigma?
I think from my clinical experience, I feel the degree of stigma any child experiences because they are different from others depends on the parents' attitude. That's my opinion. I have no research or data to prove or disprove this, but I have seen that when parents support their child, the society follows. And when parents take a very hard stand and want the child to conform and not be themselves, the society supports the parents.
That's very valuable insight.
This is what I feel, yeah.
But you know, I wanted to ask, like, at that young age where you're struggling with confidence, you found it difficult to talk to your parents, and did that change at any point?
It did. I think my parents are fairly progressive for their generation for sure. Especially because mum is Bengali, dad is Telugu, they really fought to get married, and you know, there's this whole rebellious thing happening. So rebellion is not new to them. Right. So I think that was a huge advantage to have. But it's a shock to any parent in any capacity raised in India a certain type of way to have their kid not be what everyone thinks is normal. I had several Justin Bieber posters in my room and some other attractive male personalities. And it was confusing for my dad because he's just like, what is happening? And it started to get a little overwhelming because, you know, I would be talking about Justin Bieber all the time, like talking about these what male celebrities that I clearly have a crush on.
Right.
And so at some point, you know, I did blurt out in the middle of a certain talk show, and this talk show host being fairly effeminate. You know, mum was sort of teasing that, making fun of that. And I blurted out, why would you say that? What if I was like that?
And you're how old at this point?
13, 14.
Right.
And so I was like, what if I'm gay? What are you going to do?
You're testing. You're just seeing what's the reaction.
Yeah, and I think mum in particular was really taken aback. She didn't expect it. She didn't want... as long as it's happening outside the house with anyone else's kid, it's fine. I think that's a very Indian thing to happen also, where ghar ke bahar anything works, but if it's my kid, it has to be exactly the way that, you know, people expect. And I think my parents also really had this phase of blaming each other for raising me wrong, where perhaps I was too mollycoddled by mum, is what dad used to say, or mum used to say, well, you were too masculine and influenced, and maybe he didn't want to be like you. You know,
these conversations would happen in front of you?
In front of me, and you know, it was ugly, it wasn't nice, and you would kind of feel responsible for disturbing the peace at home, right? Because what else does a child know? And that, I think, adds to the shame around who you are and what you feel, because you are dealing with it yourself, your parents are dealing with it, and now it's an issue at home. It's causing problems in the relationship between your parents and things like that. So it was a lot. Yeah, and I think very often with queer kids coming out itself is such a harrowing sort of concept that, okay, this has to happen. It's an event whereby, you know, it's a whole thing where I have to tell people and friends and family. And when it doesn't go well with people that are supposed to be by your side, that is devastating, because that kind of throws your entire world apart, right? Because you don't know what your foundation is anymore. The people that are your primary caregivers are saying, this is abnormal. I don't want this to be what my son is. This is mentally ill. And my parents are very politically correct in things now, but I very distinctly remember dad would say, ki, you know, to pagal hai. You know, why do you want to be like these people?
Right.
And I would just constantly feel like in order for me to succeed in life, the only way is to pretend and be something that I'm not. And, you know, that experience of sort of being hyper-masked, it continued into college briefly.
So then this conversation you sort of devoured,
I devoured, like,
forget it.
I was like, I'm not going to bring it up. I'm going to move on with my life and career. I will become a doctor. I will, you know, prove my mettle like that. Because Indian society unfortunately understands binaries in some ways that helped me, the doctor engineer binary. I was like, this part work, I will do the doctor bit. It worked, but then I was so deeply unhappy after a certain point living in boys' hostel, being ragged, being bullied. I was done pretending.
But the ragging happens irrespective of if you're a girl, a boy, a girl trapped in a boy's body. I mean, I think sometimes kids are cruel and schools can be a really tough place to be in for many years.
I wasn't the best at pretending to be hyper-masked either.
Right.
You know, for example, in college when we have fests and fashion shows, I would dress up in drag because I wanted.
And we one of the
And-
few people doing that.
Nobody else.
You're the only person.
I was the only person in the history of that college to wear drag at a fashion show. And it was taken positively by many, but of course there were professors and some teachers, some students that didn't see it as whatever progressive. So I got the brunt of that in hostel when I went back to live there. Because suddenly I was there was sexual assault, there was, you know, several bad experiences. And of course, my legal documents were male at the time, so not much was done about it.
Why would that be? Because I'm saying there can be an assault male on male and something can be done about it.
Yes, but not to the extent that sexual harassment laws work around women, right? So that's also a conversation that I feel needs to be had a lot more. That not having gender-neutral laws around sexual harassment affects everybody.
Right.
And it affects our boys, our men,
Right.
and women for that matter.
Right.
But I wanted to ask you, Trinetra, like through all of this, who is helping you? Who is guiding you with the legal transition, with the counseling, with just holding your hand through all of this, with...
Before all of this started, I think it was nobody for a really long time. But when the question of discovering my gender identity and establishing it came about, my parents had dealt with the initial sort of thakka to the system, where it wasn't, like gender and sexuality conversations were no longer taboo. So by the time I started talking about gender, it wasn't as much of a thing.
Like the initial shock had
The
worn
initial
off.
shock had worn off. And so I think I was 18, 19 when I said that, listen, I think this is not a sexuality thing. This is not a attraction thing. This is not a insecurity thing. This is a gender thing. And I need to sit you down and tell you that I'm not your son. I cannot do it anymore. This is suffocating. I can't live in this life, in this body, in this hostel. It's not working. And it's frankly making me depressed. It's making me harm myself. It's making me suicidal. I was in a really, really bad place at this time. And it was really affecting my academics also because, you know, MBBS is intense. And I was a really good student up until this point. So for me to not do well was taking away the one thing that I
That you
held
had,
very closely to my identity, that I was a good student, right? And so I suddenly was just so unsure of who I was that I had to fix it. Because I wanted not to just be clear with my gender. I wanted the rest of me back. I wanted to have the headspace to study properly again, to talk to a patient the way that I would like to again, without the anxiety around that. I would like to paint and draw and basically be a functional human being.
And I think also because parents are generally protective of us and, you know, they want to save us any kind of discomfort or pain of surgery or just emotional trauma. And so they come from a place of caring. Is this something that you really want to do? Is this something you want to put yourself through?
Oh, but I have to add one more thing though.
Please.
In your second year of MBBS, and this is a conversation we keep having all the time, right? In forensic medicine, a subject that we have in our second year, there is this chapter on sexual perversions, which sort of very elaborately describes how queer people are mentally ill and deranged.
This
and
chapter still
criminals.
exists in our curriculum.
It's being changed. It's a slow
Thanks to our
process.
efforts too. I think you have put a petition and
Yeah, so there was a whole process there where, but to go back to the history of this, I think in second year, this was being taught as a lecture, right? Like as sexual perversions, and then your classmates are like looking at you and you're just like, what is being taught? And it's humiliating. It's humiliating to sit in a room full of doctors or future doctors and be told by a forensic science expert that who you are is fundamentally deranged and mentally ill. And the thing is, in Indian society, we go to specific people when we need confirmation when something's wrong. A doctor is one of them. And so if you as a doctor are being trained this way for centuries, and this is the information that doctors provide, when a family reaches out, it's devastating.
Yes.
And it reinforces everything, every negative bias, every bit of phobia, every bit of, negativity onto that child or person. And that angered me, like viscerally pissed me off. Because I was like, how is it that we as doctors, people that are supposed to be noble, who understand the human condition better than everybody else, how is it that we're still here, stuck in Victorian era science? Because at the end of the day, every profession has prejudice and stigma prevalent at the time seep into it. And medicine is no exception, right? So all of the misogyny and sexism and transphobia, it's all coded into the practice of it, the text of it. And I witnessed that, as I'm sure you did too. And a bunch of us queer people and activists, we reached out to certain people in the judiciary, and there was this one judge, Justice N. Anand Venkatesh of the Madras High Court, who was hearing a petition filed by two women who were lovers, and they'd run away, and they were being harassed by the police and their family. And he didn't know enough about queerness, so he very openly said, I don't know enough, I will educate myself and come back.
Right.
And in that process spoke to many people, including myself, to educate himself. And, in this process, we also came up with, but before this, something very important that was addressed in these conversations was conversion therapy. Conversion therapy is a bunch of pseudoscientific, non-scientific methods practiced by doctors, practiced by, paraclinical people, practiced by religious gurus and other practitioners to try and fix or change LGBTQ identity and make it quote-unquote normal or cisgender and heterosexual.
And these are legal.
Absolutely illegal. The stand is very clear by the government, and the law is completely illegal.
It's illegal.
But widely practiced.
But widely practiced. And the thing is, it's not very clear, or it wasn't very clear as a result of our textbooks being this way. So back in the 60s, 70s, 80s, it would entail behavioral therapy, sometimes electroconvulsive therapy, shock therapy. I mean, he's the expert.
Conversion therapy, like they would put you and make you watch, probably, let's say,
Porn.
heterosexual porn for hours and days together, so that your brain gets conditioned to like people of opposite sex, for example. Or sometimes, even these days, I've come across reports where doctors give a person with a certain identity their same-sex
Hormones, yeah.
They try to up the levels of the normal hormones that they already have
And these
in
would
order
have
to influence the brain.
these would have effects.
Of course.
Devastating side effects.
Right.
And forget about the mental trauma that a person goes through. In fact, even the idea that my gender identity can be changed is challenging to such a fundamental level of your existence.
Right.
It's normal. Why do you want to change it?
Right.
It could be applying to any of us here, right?
Yes.
All of us.
Yes.
If I ask you to think about being like a man and I can give you an injection that will make you feel like a man, you wouldn't want it. So yeah, conversion therapy is...
Why change me?
It's a torture.
It's torture.
It's traumatic for the families, for the people who are going through it.
Dr. Pandey, I wanted to ask you, I imagine that, before a person decides to undergo gender affirming surgery, which is a big decision, there must be some kind of evaluation process. And in that process, do you sometimes feel how people say this could be just a phase, or it could be linked to something that is separate, that is emotional or psychological, and this may not be a candidate for the surgery? And then how would you approach a sensitive subject like that?
That's a very important part to explore, and that's where we psychiatrists come in actually. So when a person decides to transition, the first thing is that they have to be evaluated by a psychiatrist. We provide the diagnosis of gender dysphoria, and for that we have a very standard protocol, like we diagnose any other mental health condition. Now, a person who's going through a phase where they're exploring their gender, they generally do not want to make permanent changes in their body. They don't want to make permanent changes in their anatomy. There has to be an element of dysphoria from childhood, in most cases that I've seen, or at least 6 months is what the guidelines say, where a person wants to change their body. And that can only happen in gender dysphoria. That is not a phase. But yes, there are a lot of young people who want to explore their gender identity, and for that they go through what is called a social transition or social exploration, where they change their pronouns, sometimes use a very gender neutral name. A lot of times they realize that they belong to one or the other binary spectrum. Most of them may not want a surgery.
Right.
The only other situations where people might not be a good candidate for gender assignment surgery and they are seeking one is when they have some sort of psychotic condition where there is a delusional disorder going on. Right. Once we came across a case who thought that they were reincarnation of some goddess, and that's why they wanted to undergo the sex reassignment surgery. But of course, we treat the primary problem there, and once that delusion is gone and that's taken care of, then most of the times the desire also goes away. But that's very, very rare.
But then in those cases, there is an offer of support.
Of course.
For people going through that, and
yes.
The understanding I want is that sometimes it could be a temporary feeling that may or may not pass.
Yes, of course. So I've had clients who have come, there was one gentleman who had come and said that I've always been in I've always felt like a boy. I've been in a boy's body all the time. And recently I just put on my sister's nail paint, and I just felt that there's this side of me that I've never explored.
Right.
And then he was wondering whether this is gender incongruence or gender dysphoria. So I said that of course not, that you're not dysphoric with any part of your body or your identity. But if you want to explore your feminine side, then go for it. There's nothing wrong with that.
Right.
Yeah.
Dr. Pandey, I wanted to ask you, when an individual decides to transition, what are the steps that they need to follow? Because of course there's different medical procedures, there's surgery, there's a social transformation that happens, there's an identity transformation, a legal transformation that happens. So there's a lot of things that they need to go through. So could you talk us through?
Right. So we follow something called as the WPATH guidelines, World Professional Association for Transgender Health. And according to these guidelines, a person who wants to undergo gender affirming procedures, medical procedures or surgical procedures, they should first explore what is called as social transition. In social transition, a person asserts their gender identity socially. That means they use a name that they prefer. They use their preferred pronouns. They let their social environment know that this is who they are, and they ask the people to address them, as they are. So this gives the opportunity to the individual to understand and affirm their own gender identity before they make any permanent changes. And it also gives an opportunity for the social environment to transition, because everyone is transitioning along with this person. And once that's on the way, and of course we can be flexible about it, it's not like it's a must, it has to be practical and safe for the person undergoing social transition.
But have you ever encountered a time where they've gone through that part and then decided that the surgery is not for them?
Hardly ever. If the diagnosis of gender dysphoria is there, then I have not come across someone who's,
changed
retracted. Yes, so that's pretty affirming actually, and it gives the family members also to adjust to the idea that this person is going to look different, sound different. And then we come across this psychiatric evaluation that I mentioned earlier, and that is an ongoing support that we provide. And as far as the medical transition is concerned, we generally start with what is called as hormone replacement therapy. In this, we give the hormones of the other sex that the person wants to transition into. This is done under the supervision of an endocrinologist. This is generally reversible to a good extent, at least for the first 6 months to 1 year of HRT, it is pretty reversible. So again, we have a safe option when a person is transitioning. For whatever reason, if they want to change their minds, and again, I have not encountered a single person who's retracted, they've always wanted to go forward. But there could be some medical situation or practical situation, financial situations that a person cannot, go further. So HRT is what is recommended.
And these are injectables that happen at a clinic or a hospital?
Yes, depends actually. If a person is changing into a masculine identity, then injections of testosterone is what is administered. If they're changing into a female body, or what we call as feminizing, then there are tablets, gels that are available. Injectables are also available to feminize the body. And yes, it is done under the supervision of an endocrinologist with proper blood tests done at various intervals to monitor the side effects. It has to be done under the supervision of a doctor. Sometimes people, take this off-label or, from the market directly, and that could be pretty dangerous.
I think that's important for people to know.
Yes, absolutely, absolutely. So yeah, that's there. Then of course there are many surgical options, including genital surgery. Legal transition can happen as soon as a person starts medical transition. So that's what the law says today. You can get a transgender identity just like that without any transition. But if you want to change your sex from male to female or female to male, then you need to have undergone at least some amount of medical intervention. So as soon as you can start your HRT, you can apply. There's a proper process, proper channels, and you can apply through those channels and get your legal identity changed.
Since we referred to HRT, I'm saying even for women typically who are undergoing HRT during perimenopause, menopause, there are some certain side effects that they feel, and some of them require a little hand holding through that process.
Right.
So when you're in fact taking hormones of an opposite sex, what is the impact of that physically? Of course, you can speak about also, but also emotionally, mentally.
Definitely. Idea of administering HRT for transition is that we achieve the levels that are supposed to be there for that adult of the opposite sex at that age. So that's the normal level that we are trying to achieve. If it goes above that, then HRT will not work.
Right.
If it is too low, HRT will not work. So we have to maintain that optimum level. It is like going through another puberty.
Right.
Okay, so when a person starts taking HRT, the new hormone is settling in, the body is reacting to that. It is like going through puberty again. So similar changes that we see in puberty. There aren't too many risks per se because these are natural hormones that are present in everybody.
Right.
Like every male also has estrogen and progesterone, but at a very low level. Every
Right.
female also has testosterone, but at a very low level. So it's just the levels that we are changing, and the body is completely used to these hormones. Now, of course, like cisgender males are more prone for heart diseases or high cholesterol levels simply because of their hormonal makeup compared to cisgender women.
And cisgender male, I'm saying for our viewers, will be somebody who's assigned the sex male at birth.
Yes, exactly. So testosterone predisposes men to have more cardiac issues or stroke. Estrogen has a protective factor. Now, when we are changing a person's hormonal levels from estrogen to testosterone, we are increasing that risk, which is as much as the normal population of cisgender males.
Right.
So these are the things that we have to keep in mind. There are some rare side effects, but if it is done under the supervision of an endocrinologist, then these are monitored, and we generally do not see any problems with HRT. As far as the emotional impact is concerned, most people, when they see the transition progress, the amount of dysphoria really goes down. And when that dysphoria goes down, they feel so liberated and so congruent with their own body. So generally it is very good for your mental health. I mean, that's the idea of transition, to reduce dysphoria. Some people do report some mood swings as a result of hormones, but those can be easily managed.
Right.
Interestingly, some trans women also describe going through, PMS-like symptoms when they are taking these, estrogen supplements. I don't know what's the science behind it, but people do really experience it.
Right.
The dose is regular, so ideally there shouldn't be any fluctuations that we see in cisgender women, but people do report that. I don't know if that's psychological or if there's some science behind it.
Interesting.
But yeah, that is interesting to me as well.
Nice. What procedures did you go through, Trinetra, during this transition process? And I just wanted to know off the top of my head, you being a medical student, did that help you at all in this process?
As far as I'm concerned, I didn't know anything. When I was that young, so there was no question of doing things because I had no clue what my options were, right? Which is the case with most people. What do you know when you're like 12, 13, 14? You don't even have the words, let alone what can be done. Of course, now, if I were a 13-year-old, perhaps now I would know that there are options. But so speaking of myself, right, now this is what I believe. Anything that is irreversible, anything that cannot be undone, should be put away until you're 18. Anything that is reversible, such as the blocking of puberty, is irreversible, should be allowed before 18. Because if you're young, you're 13, 14, you're starting to exhibit symptoms of dysphoria very obviously and severely, and it's been diagnosed by a psychiatrist, and it's not just, a trend or whatever, but, a team of doctors has sat with the family, examined this entire case and said that, okay, this is gender dysphoria. Then I think it's absolutely valid and legitimate to use a puberty blocker. Because if you use a GnRH analog or a puberty blocker, then the kind of pain that spares you is incredible. Speaking of puberty blockers, I wish I had the option. But that said, I'm also very, very lucky and fortunate that I, as a doctor, knew who to go to, right? Which professional to go to for specific things to get the outcome that I wanted. And that's not to say that I sought perfection. Now, this is very controversial because what an individual seeks through transition is widely different. But coming back to this, yeah, I had certain goals, and I think that was very clear from the get-go. And with my therapist, with my mental health professional, we set those goals out. Some were realistic, some were not. And the things that were not realistic were, frankly, just a money conversation. And I also made sure that, through entertainment, through content, through the path that I've taken, I was able to make the money to do what I needed to do. Because these are, at the end of the day, very expensive procedures to this day. I had my sex reassignment surgery in Bangkok, which my parents funded. Right, I was very lucky, very, very fortunate that first important step my parents did for me. But everything else, including the face and other things, and I've talked about all of this, so nothing to hide. But the rest of it was me. And I was very clear on that I will do this, you will not do this. Because we were raised very middle class, my parents didn't come from incredible wealth, and I didn't want to burden them any further than I already had in some capacity with the weight of this transition. But yeah, I think we were talking about this in therapy a few days ago, where for almost a year now, I have felt like my transition is complete.
Really?
It's
I was going to ask you whether you feel like you're at the end of your
done.
journey.
Yeah, I mean, I think no one ever really stops transitioning in a spiritual,
Absolutely.
whatever kind of way. And we're all growing and learning, evolving, all of that. I think my womanhood will continue to change, as I'm sure you would also, agree that as a 20-year-old, you're a very different person as a cis woman. So I look forward to the change that age brings to my womanhood. But from a medical, surgical transition POV, it's over.
Could you, Doctor, speak a little bit about the impact of transitioning on reproductive health? So, for example, if somebody wanted to have a child or be a parent, before they transitioned, could they either freeze their sperm or their egg?
Yes, definitely. That option is there medically. This needs to be taken before a person starts HRT. They can freeze their sperms or their eggs, which can be used later on with the help of surrogacy in most cases, and the child could be genetically half their child. Of course, after undergoing genital surgery, they cannot bear children or reproduce in the most natural way. That's there. They definitely have the option of adoption. Once a person undergoes legal transition, their rights are just like that of any other citizen. And if they can get married to the opposite sex, which is absolutely legal in our country, they can adopt a child. However, this is still a murky area as far as the legalities are concerned. We don't have a very clear law talking about whether trans people can reproduce or can adopt. So that's something that's still a little controversial. However, the other part of the law says that if you are a male and you're married to a female, you are you have the right to adopt a child as much as any other man.
Right. So if your identity is that of a male,
yes,
and
so
you've changed it legally,
yes,
but you are a male, then you have those rights.
Exactly. But now, because the society is recognizing more and more that male is not just male, it could be also trans men.
Right.
And we've never considered the trans affix,
right,
to the general population. So the law is a little bit unclear.
I see.
Yeah.
But people should perhaps educate themselves on it if this is something
Yes.
that they're considering.
And they should
in
talk to experts about it. Yes.
As you said also, like along the way, sometimes the finances can be a reason why people don't continue with their journey.
Yes.
So typically, how much would it cost? Cis male becoming female and the other way around.
Right.
And I'm thinking because everything is typically difficult when you're a woman.
Yes.
Can I assume it's the same?
Well, maintaining a woman's body is definitely more expensive. But medically speaking, it depends on actually which centers you go to.
Yeah.
Thankfully, in our country, in our city as well, we have government hospitals and municipality hospitals which are offering good transgender care. People can start their HRT at these hospitals at nominal cost.
Right.
People can even undergo certain surgeries at these hospitals at nominal cost.
What is nominal cost?
Nominal cost would be around 5 to 10,000 for a surgery, right? Breast removal, for example, or hysterectomy, for example. As a rule, removal of an organ is simpler, and that surgery is also less expensive. But creating a new organ, that happens in multiple stages, so not too many surgeries, and therefore the cost could go up. For example, top surgery, mastectomy in a private clinic, may be around 1 to 1.5 lakhs in a city like Mumbai. Hysterectomy could be around 50,000, 1 lakh, depending again on which hospital you go to. Breast transplants could cost differently depending on which center you go to and what kind of transplants you want.
Right.
Body feminizing surgeries, those are again expensive ones because they again come in body contouring, cosmetic surgeries. Vaginoplasty also around, you can assume 2 to 3 lakhs, like phalloplasty also. So that's, the cost that I'm aware of in a metro city.
Right.
It could go anywhere upwards from there, depending on the hospital that you go through and if you need multiple surgeries or multiple stages.
And would your typical insurance packages cover this?
I don't think so. And in fact, that's another grievance I have against insurance companies, that if you have undergone transition, then they do not help you cover a lot of other illnesses that one might develop anyway. For example, if you have undergone transition into a masculine, space, then they might not cover you for heart diseases, because taking testosterone can make you more at more risk.
So they're saying that you have brought this on yourself?
Yes, exactly. So there has to be a discussion on that and proper laws on that, so that people who are transitioning are not deprived of this kind of care.
Right. I wanted to ask, what are the potential side effects or health risks, if any, that one should be aware of when thinking about transitioning, especially surgeries?
Yes. This is a very common concern that parents generally have, that the child is going to go through major surgeries.
Yes.
Yes, the surgeries are definitely major. I will not take that lightly. But these surgeries are also very routine surgeries, which are done for many different reasons. For example, breast reduction surgery or mastectomy, that's done for trans men. Now, breast reduction surgery is done for many cisgender women for many different reasons. It is done for men who have gynecomastia. So it's not a very unique procedure per se. Removal of uterus, which is hysterectomy, that's again a common procedure. Creation of a new vagina, creation of a new penis, yes, that's a little unique in itself, but it's not inherently a risky procedure. Most of these procedures are superficial. We don't have to open the body cavity, so the risk itself is a little less when it comes to these surgeries. There is an inherent risk of general anesthesia, which is present for any surgery that one undergoes. Even the commonest surgeries like removal of appendix or hernia carries that amount of risk. But per se, gender reassignment surgeries do not have a unique set of risks that one should be aware of. Having said that, if a person is undergoing a surgical process, they need to consult their surgeon completely, clear all their queries and doubts, know about the recovery period, recovery time, the pain that would be a consequence of the surgery. They have to have completely realistic expectations. That's the most important concern when we talk about post-surgical success. All right. If that's in place, then absolutely fine.
And may I ask an ignorant question, because you said these are superficial, but do they then perform superficially? For example, if you're creating a sexual organ, does it have a superficial function or does it work the same?
It has a superficial function in terms of medically speaking. What I mean is that it's above it's not inside the body cavity, it's subcutaneous. So it's done by plastic surgeons, cosmetic surgeons. So it's about modifying your skin or mucosa, at best, a little bit of your urethra, for example, in the genital part of the surgery. So that's what. It does not involve creating a new internal organ. Of course, removal of the internal organ is a part of hysterectomy, which is irreversible, but otherwise,
So Dr. Pandey, what role do clinics or healthcare and communities, healthcare clinics, etc., offer to individuals who are transitioning? Is there some way that we can make these spaces more inclusive, more trans-friendly?
Yes, absolutely. I think this is supposed to be one of the safest spaces for any individual when they go to a doctor. I've heard this joke when I was young, that you should never hide anything from your doctor and your lawyer. Right? So your doctor is supposed to be a safe space, and all the points leading up to that doctor need to be safe and not challenging. And unfortunately, because we are all humans and we are only used to what we are used to, when we see something different, we react with emotions that may make the other person uncomfortable. So as healthcare providers, it's our responsibility to understand that we are catering to all of humanity and we need to accept all of humanity. And trans people have unique support needs, not just medically, but even emotionally. So for example, in my clinic, I've educated my receptionist to use the preferred name, the preferred pronoun for a person and not just go by the appearance.
Right.
It was a little difficult for her to grasp the concept, but she's coming around. Yes, we ask the gender, we document the sex separately. Like I said, more information and knowledge about the unique medical needs, that's important. Having a ward which is dedicated to trans community probably, or giving a person the choice of their ward as male or female and not just going by their assigned sex.
Right.
That's important. Of course, and creating a friendly environment means that people are sensitized.
Right.
People know that what this person is going through and how they can treat this person in the most dignified manner possible. Yeah.
And this is, I think, their first step into the world.
Yes.
So if it's going to be a welcoming, positive step, then it makes the
Exactly.
journey so much easier.
Absolutely.
Dr. Pandey, as we come towards the end of this podcast, I just wanted to ask you if somebody who is watching this, listening to this, might be at the beginning of their gender transition journey, or maybe they love somebody, they're a loved one of someone who is thinking of transitioning, what is one piece of guidance or reassurance that you would want to leave them with?
A person who's contemplating or starting the journey, I would say go for it. We are here to support you fully in the best capacity that we can. Meet the experts, take the right help. Don't let the internet alone guide you.
That's just advice for anyone at any time.
Definitely. And someone who's witnessing somebody else's transition, they need to just support that person as they are. They need to understand that this is a very core part of their identity. And there's absolutely nothing harmful about someone transitioning.
Yeah.
So there's nothing to be ashamed of or feel anxiety about or feel guilty about.
A heartfelt thank you to Trinetra and to Dr. Pandey for joining us and for sharing their stories, their insights, and their experiences with so much honesty and with so much depth. I think that this conversation really went beyond gender. It was actually about the courage that it takes to live authentically when the world demands that you don't. It was about identity, it was about resilience, and I think a deeply personal rebellion of choosing truth over conformity. And perhaps in listening, we were all able to understand a little bit more about what it means to honor not just who someone is becoming, but actually who they have always been. If this episode resonated with you or sparked something within, then please do like, share, and subscribe. It helps us continue to bring forward stories that matter and voices that deserve to be heard. And until next time, stay informed, stay healthy, and we'll see you in the next episode.